Our next guest is Justin Lucas, nurse practitioner with Novant Health Oceanside Family Medicine and Convenient Care. Welcome to the show today, Justin.
Thanks for having me.
It's a pleasure to have you. I'm so excited to get to know you better and to learn about your new career. So let's start off by telling us a little bit about your background.
Sure. Education-wise, well, I went to North Carolina State University.
Woohoo!
Yeah. It's a tortured existence as a sports fan, but nonetheless. Studied biology there. After 4 years at North Carolina State, I went to Walden University, where I got a bachelor's in nursing. Moved on from there to NP school at University of North Carolina in Wilmington. So it's been a long road to hoe, but
Yeah. Oh, well, you most recently worked at Novant Health Brunswick Medical Center, is that correct?
Yes, ma'am. Spent a number of years there. Lots of good times there. It was a great place to work. Most recently as a house supervisor there. Served in a variety of different roles, but that was the most recent, but enjoyed all of them. It was a good experience.
What about some of the other roles that you...
I was kind of I worked on med surg for a little while. House supervisor kind of covers a broad range of tasks. So I got a lot of good experience there. Got to know a lot of the providers in the area, so it was really good. Great.
Well, I'm curious. I want to know what led you to the nurse practitioner role?
That's a good question. I've always felt like I've been called to help people. And I think a nurse practitioner provides a good medium to do so. So that's kind of what got me to where I am now.
And how long is that nurse practitioner training?
Well, you have to have a bachelor's in nursing, and there are varying requirements depending on the graduate school that you get into. Particularly with UNCW, you have to be a baccalaureate prepared nurse for at least a year.
I see.
And then the graduate program, depending on the pace of which you go through, can be anywhere from 2.5 to 4 years.
Okay. And you recently graduated. So
yes, it was a happy time. December,
I bet it was.
Exciting.
Well, let's talk a little bit about Novant Health Oceanside Family Medicine and Convenient Care in Shallotte.
Okay.
Because I know that's a really big group. There's lots of providers there. So let's talk about those providers. Can you share who those providers are with our viewers?
Sure. You're right. It is a really big practice. Lots of good folks there. There's 14 providers in all. 4 of those are MDs, and the remainder are kind of an even split between NPs and PAs, or nurse practitioners and physician assistants, all working closely together.
Yes, that is a big group. Tell me about the services that are offered at that location.
Sure. So obviously primary and family medicine.
Sure.
And there's also the convenient care clinic, which has an urgent care kind of feel, but convenient care kind of encompasses a lot of the things that that would be seen in urgent care, but not the emergent type, like chest pains, that kind of deal, things that require more emergent intervention. Also, we have X-ray, so radiology is under the same roof, along with ultrasound. We have bone density. Yeah,
do you draw all your labs there?
Labs are done there as well. Usually if we need something immediate result, then we tend to send that to the hospital just for turnaround time. But lab is in the same building, along with DEXA scanning or bone density
I didn't
studies.
Know that. That's interesting.
So they're able to do that in-house, and are read in-house in many instances.
Really?
So so we get some quick turnaround there.
Yes.
Also do occupational medicine. So
really?
That encompasses things like DOT physicals or physicals for employment, workers' compensation, drug screens, that kind of thing.
Oh, nice. Do you see patients of all ages there?
Yes, we do. I guess they say womb to tomb. So, so that's a pretty broad range, but yes, we do. Yes,
it is a pretty broad range. So pretty much everybody there is comfortable with children, infants?
Absolutely. I think you kind of have to be in this day and age.
Yeah, that's true. Well, I understand that you're going to be accepting patients of your own. Is that correct?
Absolutely. Pretty excited about it. So
wow, that is exciting, and that doesn't always happen with a nurse practitioner or a PA in some practices.
I know. I mean, I've been afforded a wonderful opportunity and already accepted a lot of new patients. So,
that's amazing.
So new patients, and also seeing folks on the convenient care side. It'll take some time to kind of build that patient base. But yeah, so it's exciting.
I think that is very exciting. I think you'll be very successful there. You're a good fit for that practice.
I appreciate it.
Let's talk about the hours of convenient care.
Yes, I had to review that myself. It can be kind of confusing. But no, it's open Monday through Friday, 8 to 8. On Saturdays, the clinic's open 9 to 6, and on Sundays, 12 to 5.
So it's open every day, but
7
the
days a week.
hours are a little different.
Yes, ma'am. 7 days a week.
And are there many providers working in the convenient care over like the weekend?
We make sure we're adequately staffed to cover anything that could potentially come in. So I think that we always have what we need.
Yeah, summer's coming, so it'll probably be a real busy time.
Absolutely.
Lots
This area
of
tends to kind of
fish hooks and
right. Kind of comes with the
oyster cuts. And
comes with the geographical territory we're in. We're ready to handle that kind of stuff.
Yeah, I think you'll be very busy there. Do you have to have an appointment, or can you just walk in?
You can just walk in.
That's
They
really
also have same-day appointments available. I've seen a couple billboards up. We'll see
Yes.
you later, same day. So that's available as well. So you
That's-
can go either route.
Yeah, that's great. Well, before we wrap up, is there anything else that you would like to tell us about Novant Health, Oceanside Family Medicine and Convenient Care?
I mean, it's a wonderful place to be. And,
It is.
And for both patient and provider alike. So, I mean, if you need anything, come see us. See if we can help you out.
Okay, well, we're real happy for you. Congratulations on your new title and your new position.
Thanks so much.
You're welcome.